So those are some suggestions. Just get moving is what I say. How do you motivate persons? Now you have a patient in front of you and they're an unexercised individual and maybe they have that new diagnosis of some sort of cancer and you're trying to reach them. And you saw my statistic, 85% of people who start a new exercise program quit by the 12th week. This is very interesting. In cardiac patients, okay, newly diagnosed cardiac patients, 85% of new diagnosis cardiac patients in all stratas of cardiac disease make it to 24 weeks. So that means only 15% of those cardiac patients, they have the fear of God in their eyes. Oh my goodness, I had a heart attack or I'm having a bypass. I need to stay with diet and exercise. So 85% of them hang on to that 24th week, which is twice as long as the Joe Q public. But then after 24 weeks, something interesting happens. That 50% of them drop off the map within 12 more weeks, within 3 more months. So I always ask myself, what's going on there? What happens with these individuals that they were so motivated early on that they beat that statistic of 85% dropout rate, but then they start feeling better, they start to forget the look in the eyes of the family member, they start to forget the fear of death. What is it that happened in that individual that makes them, after the 12 weeks, throw their success away? And I'm not quite sure about that. But that's one of the reasons why I use certain types of anecdotes, and I use a certain approach to my teaching to try to reach people at a greater level. And I've pretty much convinced myself that I'm never going to get 100% of people to stay past 12 weeks. But if I can turn the 85% dropout rate to 50%, then I can sleep at night and I can know that I did a good job. So I have a very education-intensive approach to my work. I don't say, take my word for it, you should exercise, because we already know that. I already saw a lot of nods when I asked that question. I try to teach people, why should they exercise? What happens to the blood vessels in your muscles, in your heart, in your neck, in your brain when you exercise? What happens to the muscle cells in that type 2 diabetic when they do aerobic exercise, when they do resistance exercise? Now, a lot of people sometimes say to me, oh, I don't need to know that, just tell me what to do. And I still beat those messages down their head, because I think I'm trying to empower individuals to understand why I should get out of bed on that day where I don't feel like it, versus just take my word for it. And I think it falls under the auspice of some of these anecdotes that I listed, in that if you give a person a fish, they eat for 1 day. So if I tell somebody to exercise and do this right here, and I'm standing right there in front of you, they're going to do those 20 sit-ups or 20 push-ups on their knees or whatnot. But if you teach a person to fish, they can eat for a lifetime. If I teach a person why they should do those squats or why they should do that 20-minute walk every day, and what happens when they don't with regards to their risk for cancer or heart disease or diabetes, why should I do that? What have you seen, Jason, at your workplace that makes you so sure I should do that? We see people disappear every day, and we know where they go. And it doesn't have to be like that. So my educational intensive approach really falls under the guise of empowering individuals to make their own decisions, because we need to do that as individuals. We're strong-minded Americans, remember that. I like that. I didn't make that up. Does anybody know who made that up? Let's just call it an ancient Chinese proverb, right? All right, check this one out. This one's kind of cool because it's apropos and it's pretty current. When diet and exercise is not enough, ask your doctor about, who's seen that television ad? I mean, well, yeah, you know, someone said that, you know, the drug name or a drug name. You know, how much diet is enough? How much exercise is enough? You know, what should I ask my doctor about? And now it's on a television ad seen by not just millions, but hundreds of millions. When diet and exercise aren't enough, ask your doctor about Zocor. Fast forward 2 slides back, you saw 85% of people start a new exercise program, quit by the 12th week. So somewhere around week 10, 11, or 12, people are calling the doctor. You know, I've done a lot of exercise and I'm working on the diet and it's just not enough. So what's that thing they're telling me to ask you about on the ad? Is it glucophage? Is it Lipitor? Is it a statin drug? A lot of these drugs, interestingly enough, are developed using analogs of exercise-induced pathways. Anti-diabetes medications, they've looked at what happens with exercise with fuel utilization. Can we mimic that with an isomer or a drug that looks like the metabolic waste product from exercise? Glucophage. What happens with exercise in terms of fat or lipid utilization? And how does it augment it with exercise? Can we get a microscope and try to find a chemical analog that can mimic the lipolytic effect, the fat burning effect, or the variations in how your liver discharges fat? Those are the 2 things that statin drugs kind of do. What is it about downregulating your inflammatory response with exercise? That's the thing that makes you feel so good after about 6 weeks. Oh, I feel much better now that I'm exercising. What is it about the anti-inflammatory response with exercise that makes me feel so good? And can we mimic it with CoA reductase inhibitors, also known as statin drugs? And that's very interesting when you have me here, an exercise physiologist, talking to a group of lovely individuals about how great exercise is and how we all need to do it. And you look at the most widely and broadly used drugs in our culture and in the diseases that we're attempting to treat with them, they're mimicking exercise to use it. That's more power for us to say, hey, you know what? Try to find a way to make diet and exercise enough. Because it's so much easier to open a pill bottle and pop it in your mouth, and then it's a very passive approach, and then drink water and get it down there, and for the next 23 and a half hours you're under the influence of that medication. That's a pretty passive approach to managing your health, and I'm not saying it's not salient. It might be necessary, but try everything you can do to get you and that person or that patient sitting in front of you to make diet and exercise enough.
Who's rockin' at your who's rockin' who's rockin' at your door? Who's rockin' at your hip hop knockin' who's rockin' at your door? Taste the famous, suit 'em up, mosh. How do you reverse the